So what are the challenges in assessment of bilingual kids? Well, Grosjean always says that monolinguals, or has said, and this has been quoted very often, that bilinguals are not two monolinguals in one. And so when we're testing bilingual kids, we probably need to do something different than what we would do for assessment of a monolingual. We can't necessarily give the same thing in two languages that you would do for a monolingual Spanish child or a monolingual English-speaking child. One of the challenges in looking at bilingualism is that it's highly variable at an individual level. So the amount of contact that children have with each of their two languages is going to vary tremendously among the children that you might be working with. What are ways that we might think about measuring their first and their second language? And there's a number of things that are recommended that we look at in the literature. Things like the age of their second language exposure. So at what point did they start learning English? And we have some kids who start learning English and Spanish from birth, and some kids who have their first English exposure when they're in preschool, and others when they're in kindergarten. What's their current use and exposure? How much do they get English input and Spanish input in a typical day? And then we could do direct testing. But when we do direct testing, what do we test? Do we test vocabulary to make a determination of their language proficiency or their language dominance? Do we test grammar? Do we test their narratives? So the kinds of measures that you test can also vary tremendously. One of the things that we have been looking at, because we think it's really important to disambiguate level of dominance in a language or proficiency in a language from language ability. What we're trying to do as speech-language pathologists is identify whether this is characteristic of an impairment in language or an impairment of speech. And so if we we want to find measures that might help us to disambiguate that from how much exposure they have to each of those two languages. One of the things that we've looked at is how much exposure. So how much do they use Spanish, how much do they use English, and how much do they hear it? And we've looked at this against, for example, semantics. So in this slide, you could see that we have children who use English 60% of the time or more. Also, were heavily English dominant on a test of semantics. Over here, children who used Spanish 60% or more of the time were also heavily dominant in a test of semantics in Spanish. But the bilinguals who use Spanish and English more or less the same, between 40 and 60%, which is, clusters around 50-50, there's a small number of them who also showed balanced performance in semantics. Okay, and so we have these differences here on the ends. So in terms of exposure, we have 122 kids who have balanced exposure, 80 children who show balance in semantics, but 39 show balance on both of those measures. And so for these bilingual kids, we get more dispersion around the middle. So these bilingual kids are much more variable in what they hear and how they perform on different measures. We take these same kids and we do the same thing with morphosyntax. And that changes, again, at the two ends of the continuum. So the kids that get exposed mainly to English do really well in English. The kids who get exposed mainly to Spanish do really well with Spanish. But those kids in the middle show some differences. And morphosyntax, we have an even smaller number of kids who have balanced exposure in Spanish and English and balanced performance in Spanish and English morphosyntax. And we have these differences here represented by these boxes. So 122 who have equal exposure, 33 who are balanced in their performance on morphosyntax. And so you get a lot of dispersion around the middle for those bilingual kids. And then last, we looked at the cross tabs between morphosyntax and semantics, and we get that same kind of pattern. And this is, again, with the same group of kids, and then some differences at the end. So the story I'm trying to emphasize here is that bilinguals are variable on a number of these different variables. Variable on variables. Okay, so a challenge then is, what's a true language impairment, and what is simply an outcome of having divided input and divided use of each of your two languages? Have you not had enough time to master the semantic system yet, and that's why the scores are low, or is it really language impairment? Have you not mastered the grammatical system of your second language, or are you still in the process of learning it? And how do we disambiguate those two? Because of this mixed input, sometimes second language acquisition looks like primary language impairment or language impairment. And also first language loss might also look like language impairment. So when you're going through that shift of acquiring a second language, and maybe the first language is in attrition, or there's not as much exposure to the first language, you might start making errors in that first language that look very much like the errors that you see in monolingual children who have language impairment. But this is what we have to disambiguate. We know also that in different kinds of domains, children have different kinds of experiences. So we might see sociocultural experiences also play a role in how kids perform on standardized tests, especially tests that are normed on a monolingual population. So kids may have gaps. They may know some things in one language and have lexicalized other things in another language. So it's really common for preschool kids to know, have really good home vocabulary or in Spanish and really good school vocabulary in English, but they don't necessarily have translation equivalents of all those things. And you're going to see this across the different domains. So depending on what the demands are, and those linguistic demands are tied to a specific language, you might see some variability across their two languages. So what do we do in terms of thinking about test development for this population that is highly variable, that has divided time in each of their two languages, where age of acquisition of their first and second language is going to vary tremendously, and where familiarity of content is going to vary? We need to do something more than what you would do for a monolingual test. When you're developing a test for a monolingual population, you assume that these aren't variables that you necessarily take into account. Maybe familiarity of content, but age of acquisition of L1 and L2 isn't an issue, and divided time between two languages isn't an issue. So how do you take these into account in addition? Usually when you develop a standardized test, your goal is to classify language impairment or phonological impairment, and you want to develop items that are challenging for your clinical group. So those items are sensitive items for phonological impairment or for language impairment. At the same time, you don't want those items to be sensitive to different levels of children's experiences. So you want those items to be insensitive as much as possible to variation that might come from things that are not related to the clinical marker that you're looking for. Okay. So what do you do? What we have been really focusing on is really looking at items and looking at the item level data in terms of development of a test. And we used an item analysis approach where we compare item level differences between children with typical development and children with language impairment or phonological impairment, and items that did a good job at differentiating those two groups are items that we want to keep. Okay. At the same time, we also want to make sure that at these different levels of linguistic exposure, that those items still work. If you vary on this other dimension of L1 and L2 exposure, or on the age at which children started learning a second language.